Hello, Suzanne with Dawning Visions Hypnosis. Here's a question for you. Are you sick of having to upsell your patients to psychiatrists for medications? This was indeed one of the situations that came up when I was doing research regarding why therapists leave practice. One of these people said that they really resented that they were supposed to send their patients to psychiatrists to get medicated. Because in a lot of cases, he didn't feel that was necessary, number one, and number two, he felt it was undermining his position with his patients. I don't know exactly how you feel about all that, but I know that, at least as far as my practice is concerned, I'm happy when my clients come to me about being on medication. Because medication dulls their emotions. Sometimes it messes up their thinking processes, and they do complain about that. And it can depress them in terms of their energy that they have in a lot of ways. Never mind some of the really bad side effects that come with antipsychotic medications. So, I don't know exactly how you deal with this issue, but I know what I do is I got out of conventional mental health. I wasn't interested in seeing people medicated with toxic medications for the rest of their lives, especially when it comes to kids who are put on so many medications instead of learning how to self-regulate their emotions. And to tell you the honest truth, most of it is just because Big Pharma pushes this crap endlessly. They spend more money on marketing than they do on research and development. That's a fact. So we have to ask ourselves, why did we get into the business in the first place? Was it to medicate the patients, or was it to be able to help them to learn how to cope with their lives, give them tools and techniques so that they wouldn't have to be on medication? Because I can tell you from my practice of hypnotism for the last 20 plus years, most of my clients don't need any medication. It's a fact. I don't care what they're diagnosed with, except for the psychotics, which I don't work with in the first place, if I can help it, because I'm not really trained to work with them, quite frankly. I know how to work with them in terms of conventional mental health because I worked with a few of them when I was in conventional mental health, and I had a wonderful psychologist of one of my past clients teach me. However, they're not really the best subjects for hypnotism and neurolinguistic programming because they have to be able to focus on what we're doing. And if you're having psychotic events going on, that makes it pretty difficult to do that. We also don't work with those with personality disorders as diagnosed by a mental health professional because they're not able to be helped. I don't care what anybody says. I was raised by one, and I know that my mother spent, I don't know, my entire childhood in therapy, and it didn't help her a damn bit. Not at all. It wasn't that she didn't want to be helped. It's just that she couldn't be helped. You know, emotionally, she was on a 2-year-old level. Super intelligent, but emotionally, forget it. Just the way it was. As stated by her psychologist, who me and my 4 sisters got to have a visit with the day before my dad's funeral. Yes, that actually happened. Of course, that was a lot of years ago now, many decades, but still, that was a reality, part of my world and my life. So, how do you deal with this? It's a question. If you understand how to do hypnotism and neurolinguistic programming, guess what? You're able to help your people without any medication. Those who are actually invested in healing. I've done it for 20 plus years. I've helped a lot of people, thousands. People with diagnoses that were supposedly untreatable. Well, maybe they were treatable in terms of management of symptoms, but not healable. Not curable, quote unquote. a word I'm not supposed to use. So I use the word healable. Because you know what happens? When people are able to understand the cause of their problem and the purpose why they're holding on to dysfunctional behavior and have a compelling future, they're more than willing to let it go. You just have to facilitate it. So if you're interested in learning how to actually do that for your patients, I have a 2-day VIP program where you can learn how to do all the techniques that you need to learn, 7 hours per day, one-on-one, online, with a 12-month mentorship where you can send me a message and we'll set up a time for a video call so I can tell you exactly how to go about using the techniques appropriately for the client that you're working with. My trainees love the program. I had one trainee, PhD in psychology. She left medicine, as she put it, because she couldn't stand it anymore. She makes over $400 an hour doing coaching. That's right. No insurance companies, no associations to deal with any longer. And she's having a great time, and she's helping a lot of people. That's what I'd like for you. So I'll have my information in the description box below, and we can set up a time to have a video call to see if that's something you'd like to pursue. That's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.